Your hips play a huge role in the strengthening and stability of your pelvis and pelvic floor dysfunction treatment. And the video I'm about to show you has to do with hip mobility, so stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. Like I said, your hips are connected to your pelvis, therefore lack of stability and connection to the rest of your body in movement play a huge role in that tug of war that can take place because there's restriction here and the pelvis does not have that mobility it needs to have. It leads to weakness in the floor, the walls of the pelvis, and overall in the health of your pelvic floor. So the first thing to do is to assess yourself to see if you have decent mobility, and if you don't, that assessment becomes the actual exercise. So in this position, you should be able to place your feet flat on the ground and have the middle of your ankles, middle of your knees, and the middle of your groin all line up in that straight position. And feel comfortable. If you don't feel comfortable sitting like that, you can use your hands and place them in the back as wide apart as your shoulders, just don't sink in there. So your muscles in the back and the front of your body will lift you up, an elongated spine, so it's as if I'm being pulled up in the direction my torso is angled, and place it there. I'm going to bring my feet a little bit closer, and what I want to do is I want to stabilize my pelvis as much as I can and simply move in one direction. This is as far as I'm going to go before I'm totally twisted, and then together the legs are together lifting up, so by the time they get to the center, they get to the center together, and we go to the opposite side. Let's say I stop here because I can already feel things pulling. Well, that's where I'm gonna stay and really control. I'm just gonna remove this leg for the sake of this video. I'm gonna make sure that my knee is not lower or just kind of hanging there because it's being restricted by my restricted hips. So I wanna have a controlled engagement of the inner and outer leg, not just the thigh, the whole part. Going in, and then let's say if I'm stopping there, I'm just going to come off and go back in, and this time try to go beyond that level that I could. So I'm just going to go through that movement and the movement there. And don't expect miracles to happen tomorrow. You're going to have to go through this process. This is the game of persistence. You gotta be persistently going after doing these things to loosen up the connection of your femur to your pelvis and have that full mobility. All the hip core and controlled articular rotation, that's what CAR stands for. All of those are great exercises. We'll do other videos so you can get to see them as well. If you have not subscribed to the channel, this is your opportunity to do so. I have another channel that has to do with functional movement. Make sure you check it out in the description box, and you may want to subscribe to that as well. If you have any questions, contact me. Check out the description box again. That description box has a lot of stuff there. And until next time, take care.